Hi, this is Professor Laws, and in this video series, we're going to talk about the differences between surgical masks and respirators. So let's get started. Now we're going to evaluate these. That's our drawing of a surgical mask on the top and an N95 respirator on the bottom. We're going to look at 4 criteria: fit to face, if you require a fit test, is it one-time use, and the effectiveness of the filtration. Now, a surgical mask is like your basic mask that you see on any healthcare unit. It's very loose fitting, which is different than an N95 respirator. An N95 respirator is extremely tight fitting. It's really close, and if you have kind of claustrophobia, sometimes these can be difficult for you to wear. Now, as far as a fit test being required, you don't need one for a surgical mask, but you do for an N95. Now, let's look at what that involves. It's a series of tests and assessments performed by a trained evaluator. So individuals can't fit test themselves, and there are several steps, including can you smell things if they're trying to test and see what's making it through that respirator. They want to make sure that that respirator forms a tight seal on the wearer's face, because fit equals effectiveness. So I love this drawing. It's the bearded baby, because N95 respirators are not designed for children or people with facial hair. And if you have a baby with a beard like that, they're really not going to be appropriate for an N95 respirator. You can't get a proper fit on a child or someone who has a beard. That's why it may not provide full protection. So, as a review, a surgical mask is loose fitting. It doesn't require a fit test, but an N95 respirator does. Now, as far as one-time use, both are considered one-time use. It's become a hot issue in our news about reusing N95 respirators. They are intended for single use, but if they keep their structural and functional integrity, OSHA has determined if the filter isn't physically damaged or soiled, they can be reused. While not optimal in times of extreme shortage, that is going to be the most effective choice. Now, the surgical masks are not reliable for smaller airborne particles. That's really important that you understand that. Somebody with an airborne infectious disease like COVID-19 has smaller airborne particles, and a surgical mask is not going to protect you with that. What a surgical mask can do is what it's intended to do. If you wear it appropriately, it will help block large particle droplets, splashes, and sprays or splatters that may contain nasty bugs, like viruses or bacteria. Those may keep them from reaching your mouth or nose. Those are large particles. The problem is COVID-19 has some small ones, so they won't protect you from COVID-19. Now, they also might help your patients, so might help reduce other people's exposure to my saliva and respiratory secretions. That's another good thing. But keep in mind, surgical masks were not intended to provide protection from COVID-19 virus. So it's not reliable for those smaller airborne articles, where a N95 respirator filters out at least 95% of the airborne particles, and that's easy to remember because it's called an N95 respirator. So this is the Cadillac when it comes to masks of personal protective equipment. It's FDA cleared. They're labeled as single-use disposable devices. They'll have a very close facial fit and a really efficient filtration of airborne particles. But in times of shortage, they can be reused. So let's wrap up this video. Surgical masks and respirators are both considered personal protective equipment for healthcare personnel. Both are considered single-use items, but respirators can be used in times of critical shortage if not visibly compromised or they don't present an increased difficulty for the user to breathe. Surgical masks are not reliable for smaller airborne particles, and they don't provide protection at the level of respirators. Respirators filter out at least 95% of airborne particles, but they're more expensive and require fit testing to be effective. And in times of pandemic, we can run into a critical shortage. Hey, thanks for watching this video with us today.